my name is Sheila Eswaran. I'm a hepatologist, which is a liver specialist, physician, and I work at Rush University Medical Center. I'm happy today to talk to you about different ways individuals with liver cancer can feel empowered. And I think this is a great transition after hearing from Daryl and Daniel, the patient stories, and the presentation on uncertainty, to talk about some practical strategies for patients and family members to feel educated and empowered. In my experience, I think we all feel more in control and empowered through education and communication and removing some of the mystery around what to expect through the liver cancer journey. Opportunities like this conference through the American Liver Foundation or a type of conference like this and doing research through reputable organizations are great ways to get information. And then it makes it a little less scary and more manageable. Getting information and asking questions will give you a foundation, then to make the most of your discussions with your healthcare team. And really the most important thing I think that's been highlighted by many of the speakers today is to ask questions in each phase of your journey. And the different phases would be the diagnosis phase, the understanding the stage of your cancer, looking at treatment options, and getting to know and interacting with your team really of providers. So that in the next 20 minutes, I'll try to give you an idea of what questions to ask, some practical strategies in each of those phases so that you can feel more educated and more empowered. I don't have a lot of slides, but I do have just a few. Can you see my slides, Ivory?
Yes.
Thank you. And that first one is the empowerment through understanding. So these are sort of the different phases of your journey: diagnosis, the stage of cancer, treatment options, and meeting your team. When early on in your journey, it's really important to understand your diagnosis. As has been discussed in this conference so far, there are actually several types of liver cancer. Hepatocellular carcinoma is the most common type, and it occurs in the background of cirrhosis that's been described. But there are other types of liver cancer, cholangiocarcinoma, and also cancers that start somewhere else outside of the liver and then move to the liver as a metastasis. So it's really important to get the understanding of what type of liver cancer you have, because it really changes the outcome, your treatment options, and who you might meet during your journey. So asking specifically what type of cancer is it? Is it hepatocellular carcinoma, cholangiocarcinoma, or metastases? And then once you understand the diagnosis or the type of liver cancer, you want to ask your team and really understand what stage of cancer you have. Are you have liver cancer that's early stage, intermediate stage, or advanced stage? And as Dr. Mehta was describing, that stage of cancer is really based on the size, the number of the tumor, and whether or not it's in the liver or if it's spread outside of the liver. So if you understand what type of liver cancer you have and the stage, it's at that point you can think about what your prognosis is and what your treatment options are. And so when you're moving to the next phase of your cancer journey, that would be the treatment phase, you want to think about, of the treatment options, which ones are appropriate for your stage, because not all of them are. The good news is that there's a lot of different types of treatment options, including surgery that's been discussed, procedures performed by interventional radiologists, liver transplant, immunotherapy, other chemotherapy. So there's a lot of different treatment options, but they might not all be appropriate for your stage of cancer. But when considering treatment options, you do want to think about whether or not they're pills, if you're interested in taking pills versus infusions, whether or not it's a procedure or surgery. Those are things that you would discuss with your treatment team, and asking questions about what is involved in each of the treatments will help you feel more in control and more empowered. When you're thinking about treatment options, you want to ask and consider for yourself how much pain there might be involved or discomfort or other side effects such as rashes, weight gain, things like that. Other side effects can be considered. And also if you're fairly physically fit and otherwise enjoying life and doing the things, having a normal quality of life, you want to consider when thinking about treatment options, how much those treatments will interrupt your lifestyle, how much time each treatment will take. If someone has to go far away to get their treatment, is driving time a consideration, and recovery time. So these are things that you should consider when considering different treatment options. And also keep in mind for treatment options, what's thought about and discussed with you, with your treatment team, is how your medical conditions, other than cancer or liver disease, might affect your cancer treatment, and how your cancer treatment also might affect your other medical conditions. For example, if there's a treatment option that may worsen blood pressure and there's already an underlying high blood pressure medical condition, then that would need to be considered. So there's an interaction between other medical conditions and the treatment options, and then the treatment options with other medical conditions. So as you're going through each phase of your journey, whether it's diagnosis, understanding the stage of cancer, treatment options, these are the types of things that should be considered so that you can feel more empowered and ask the right questions in the time that you have with your treatment team. So the next sort of big, broad topic to help you sort of break down a little bit the mystery behind liver cancer and liver cancer management and what you might expect would be understanding your treatment team. Dr. Mehta had mentioned the multidisciplinary team, and this is very important because liver cancer management is really not one size fits all. There are a lot of different treatment options, and so the approach to liver cancer management is the approach from different specialties, and we term that a multidisciplinary team. And the providers will discuss a clinical case, a patient that has liver cancer, identify their stage of cancer, look at other medical conditions, consider the underlying liver function to consider what treatment options patients have. And we all come together in a group, usually once or twice a week, as a tumor board conference, and then we communicate the recommendations to the patient and their families. You might not see all of these providers, but it should be a part of liver cancer management. And so I use this visual to help patients and family members understand what that multidisciplinary team is. And there's the patient in the middle, because we're all here for the individual that has liver cancer. And other than you in the middle, the most important member of the team is the nurse coordinator. This individual is your point person. It's your liaison. It is your person to help coordinate appointments, get records, refer you also to the supportive oncology groups that were discussed in the prior presentation, the dietitian, the social worker, the mental health providers, the clinical trial coordinators, the pharmacist, the complementary medicine team. So the nurse coordinator is really the point person for you, and you should be able to access that person easily and understand how to communicate with that person. The next member of the multidisciplinary team you should meet is a hepatologist like myself. We are a liver specialist that focuses on chronic liver diseases and acute liver diseases and liver cancer. And it's our role, my role, usually to make the diagnosis of liver cancer and stage the cancer, and then help facilitate this multidisciplinary discussion. I also, as a hepatologist, will assess the liver function through an examination, blood testing, an upper endoscopy, which is a scope test to look at the esophagus, to look for changes related to cirrhosis, to really get an understanding for the patient and the rest of the team what the function of the liver and what the liver and the patient can really tolerate in terms of treatment options, and that can inform the decisions for treatment. And then each time a patient undergoes a treatment, then they would come back to the hepatologist to reassess the liver function throughout the whole journey. And we see patients with cirrhosis along this continuum. Part of the team, there are two different types of radiologists. One is a diagnostic radiologist. These providers help us make the diagnosis of liver cancer. Like Dr. Mehta had described, usually we don't need a liver biopsy to make the diagnosis of cancer, and we really rely on that LIRADS criteria that is determined using a CAT scan or an MRI. And the diagnostic radiologists help make that diagnosis. Also, when patients undergo treatment, they have imaging, CT or MRI after the treatment. And then the diagnostic radiologist helps us determine if they're, what the response is of that treatment. An interventional radiologist is part of the multidisciplinary team to help us make the diagnosis sometimes of liver cancer with a biopsy, but not always and not usually. And then the interventional radiologists also help determine if patients are candidates for liver-directed therapy. That's the TACE, transarterial chemoembolization, the TARE, transarterial radioembolization, or other forms of ablation. So they help determine based on the size and the location of the tumor if those would be options. And then they perform those procedures. The surgeon is a part of the multidisciplinary team, and they will perform resection or removal of the liver cancer, or determine and perform patients, if patients are candidates for a liver transplant. They look at other medical conditions also to make sure that patient heart and lungs are strong enough to undergo surgery. The medical oncologist, with this boom of immunotherapy for all types of cancers, especially liver cancer, a medical oncologist helps determine candidacy for systemic therapy. And there are a lot of therapies on the horizon that the medical oncologists stay abreast of and are a part of this discussion in the approach to liver cancer. Radiation oncologists, haven't talked about that as much through this conference, but there is options for external beam radiation, and this can also be used in conjunction with other therapies like the liver-directed therapies. As was discussed, palliative care And also pathologists are sometimes present during our multidisciplinary tumor board to look at different cell findings under the microscope to help direct management. So this is your team. These are all the individuals that are usually a part of the discussion and trying to decide with you what options are appropriate based on the stage of cancer. Research really has shown that the multidisciplinary approach in patients with cancer really is important, and they have better outcomes, including better curative results. They have better quality of life and patient satisfaction, and they have a better and shorter time to treatment. And recently, we've all felt more comfortable with remote collaboration through Zoom and other platforms in the medical field, especially after COVID, being able and more facile with remote collaboration. And so if you are at an institution that doesn't have access to a multidisciplinary tumor board like this, there's often an association with one that can review and manage your case remotely. So that would be a question to ask. And lastly, to wrap up, I wanted to give some quick tips and tools that patients and caregivers can use in your time with your provider. It's really important that you understand and are able to contact that nurse coordinator. They should have, you should have access to them using telephone numbers. Also, it was discussed that there's the patient portal through electronic medical records. It's often called MyChart. You should be able to communicate with your care team that way, or email. I also find that it's helpful to collect cards. If you see a lot of individuals during your visits, ask for their business cards. And if it says, in mine, it would say Sheila Eswaran, MD, hepatologist, then write in words there, liver specialist or my cirrhosis doctor. And that way you can put a face to the name. And if you have specific questions for that provider, you can pull that card up and reach out to them directly. It's important to prepare or consider preparing questions in advance. I give advice that you put the questions with the most important on top and the least important on the bottom, so that if you're finding that you're running out of time, that you have at least asked the important questions that you have on the top. You want to get information from reputable sites such as the American Liver Foundation, the American Association for the Study of Liver Diseases, AASLD, or the NCCN websites. And there also you can get links and access to support groups like this one with the American Liver Foundation, so you can continue to feel empowered and understand liver cancer and the diagnosis. And then go to your treatment team to ask questions. You should ask about new research and innovative approaches. If your team, the providers are offering treatments, you can ask then, this is standard of care, yes, but is there anything on the horizon I should be aware of? You want to ask, it's very important to bring a friend or a relative with you. It gives you a second set of ears. A lot of times in the clinic visits, meeting a lot of people, you could be overwhelming, of course, and having a second set of ears to have remember what has been said is important and can be a practical tool to make the most out of your visits. Also, when that friend comes, it is helpful for them to take notes. I generally say that the patient, the individual with liver cancer, shouldn't take notes. If you have another support person coming with you, the patient should really be able to be engaging with the providers and feeling the feelings while maybe the support person is taking notes. And then you can go back together and review those later on. And I think this has been mentioned several times, especially by Daryl and Daniel. You know, if you don't understand, speak up. Your team is there for you. And people learn and understand in different ways. So if you're a visual person, or if you would prefer written information, ask for materials. Should be provided by your multidisciplinary team. And when you see your provider and your team, really, before you leave that visit, you should know what's the next step. How do I get in touch to make the next appointment? What treatment option is next? What do I do next in the short and long term? Asking these questions will help you feel more empowered and will give you education around your cancer diagnosis and remove some of the mystery. And it's really, like I said, coming to conferences like this to understand liver cancer, know what questions to ask, and that's really the best thing that you can do to feel empowered through your cancer journey. That's it for my talk. I really appreciate the invitation to speak with you all and to get a chance to be a part of your journey. Thanks.
Thank you, Dr. Eswaran. We have a couple of questions for you. The first is, does the same team stay with you pre and post transplant?
That's a great question. So usually patients that are diagnosed with liver cancer will see a hepatologist. So that's a doctor like myself that focuses on liver disease. And then we make the diagnosis, and then you see the multidisciplinary team. If someone goes through a transplant pathway, they'll see the multidisciplinary team for transplant. They'll be evaluated for transplant, listed for a transplant, undergo transplant with the transplant team. Oftentimes they are all the same teams, yes. And then after transplant, after a certain period of time, depending on the institution, they'll return back to the hepatologist, usually that saw them previously. But yes, both the multidisciplinary team that are part of liver cancer management and the transplant team do overlap. So they are the same team.
And the second question is a little harder. If you don't feel like one of the people on your medical team is right for you, can you replace them? Or if not, what do you suggest?
Oh, that is a great question. I'm so glad you asked. You know, it is not a one-size-fits-all interaction. Sometimes there is not a great connection between a provider and patient, and that is very understandable. Hopefully it doesn't happen a lot. I would say there's always an option for a second opinion. If there is a provider that may not be a good fit, one option, if there's a multidisciplinary team, is to ask the nurse coordinator, that one liaison, that point person for the multidisciplinary team, about your concerns. Speak up. And there's oftentimes someone in that same institution that does the same thing. And then we all understand as providers that people don't always have a connection. We're human. And so usually oftentimes there's someone that is available. If there isn't a person in that institution, then oftentimes there are associations or connections or collaborations outside that institution that usually we can find a good match. So please speak up. We all understand.
Absolutely. It really falls on the patient to be able to advocate for themselves here. So it's important that they feel heard and like their relationship with their treatment team is not impeding their care.
Absolutely.
Okay, I think that is all the questions we have. Thank you so much.